First of all, how are you and your family doing?
You know, my cousins and I, we were very much affected by this chain of you know, our elders passing. I lost 2 aunts, 1 cousin, 1 uncle, all, you know, from the same family, and we were confined in sorrow. For me, just the idea of knowing that my aunt who died, you know, in a long-term care, you know, Center for Elderly People in Montreal, died alone. She could not be accompanied or assisted in her, you know, final moments by her son or, you know, or other members of the family. And it could have been possible, you know, to accommodate that with, you know, the same way you have the frontline workers with the same precautions, same protections, you know, gloves, masks, whatever. But providing, you know, the conditions for a person to die in dignity. And this is atrocious. I just spoke again to one of my cousins, and he was saying, and it's all in us. That pain stays with us, you know. I have my moments where I'm completely overwhelmed by the sadness, and I knew that as I was posting, just, you know, in few words, a few facts about the losses in my family, that I was just, you know, talking about something that thousands of other families are experiencing, or thousands of families are fearing right now, you know. And I find that we rushed into measures of prevention to control, you know, the spread of the virus, but we left aside the human dimension. You know, no memorial possible, you know. I find this very difficult. It's very difficult for us to accept. You know, even in some of the countries, it was allowed, you know, just maybe 5-10 people together, taking the right precautions, staying at a distance, not hugging, not, you know, not kissing, not holding hands, but at least as human beings, we know how to raise our voices, you know, to share the pain and pay tribute to the person, you know, our beloved, you know, relative in this passing, you know. So
it's kind of the combination of the heartbreak of them dying alone and then not even being able to acknowledge it together.
Not being able to acknowledge it together, and not having had an opportunity to accompany them, to be there with them and for them, you know. It's very difficult.
Do you feel that that those policies, you know, and I do know that the governments of all types were motivated then by very much reacting to the possibility of the spread, but do you feel like those policies were a mistake?
In our countries where we have, you know, aging populations, we saw the proliferation of these centers. It's a business. They could, and there wasn't any adequate, you know, government surveillance.
You called them oblivious in what you wrote.
Yeah, yes. I think when I see some of our decision makers and leaders saying how terrible, you know, to see these reports and to see what is happening, people malnourished, you know, flagrant neglect, people left, you know, in their bed sores and their urine and excrements. I'm sorry to say that, but this is what it is. And saying how terrible it is for them to see that. But where were you? We have to stop being oblivious, of the facts and of the realities happening. I remember as I accompanied my mom who suffered, with Alzheimer. And I saw, I had to find a place for her. She couldn't, she needed to be assisted on a 24 hours basis. And already in my culture, it wasn't an easy decision to make. And I saw these centers really, dangling all, the promise of quality care. And when you would look carefully, you would see the neglect. And I had really to make sure, I remember the perseverance it took me. I would talk about it to social workers, and it was considered only on a case-to-case basis, Like each time you raise, a story in the media, then the government would feel questioned and would look into it, but there was not, a comprehensive, I would say, examination of the situation, right?
You used in the piece that you wrote when you talked about some of the issues at long-term care homes, you mentioned the idea of money making, right? And we know that these homes, many of them, it depends on the province and the construct in the province, but they are for-profit models. Of course. Do you think that needs to change? Do you think the for-profit model should be abolished in Canada?
I think it's about our responsibility really to make sure that people are not exposed, to neglect, to protect people who are in danger when we don't look carefully. We don't have, policies in place really of surveillance, of really close, looking closely at what is happening in these centers. If we don't do that, we can see the consequences. We can see how devastating it can become, in a time of pandemic. But the situation was there, and nobody really addressed it properly. So I think it's this discussion must happen.
I have covered this now for the last number of months, and this was, of course, one of the most important issues, the long-term care issue. And there is often a deference to jurisdiction on both sides, right? This is the provinces that oversee it. The feds need to give us more money. I'm wondering if you think if the federal government should just take the system over, if this piecemeal approach, province by province, which I understand is so critical to the federation, just hasn't worked, or if when you talk about transformational change, it has to be something along those lines.
Yes, and you know what? Let's not make it the constitutional issue on the share of powers and responsibilities. I think there's a national discussion that must happen about it. I think that the provinces themselves are asking for help. They see how some had to ask for, the Canadian forces to come and assist, and then the reports were very, disturbing, very disturbing. It took a pandemic to see, the truth. It's a moment of truth, and I, as like yourself, you heard, some family members talking about it and saying, we were not listened to. We were not listened to. I think health is a fundamental right. Access to health and quality care. It's a fundamental right that Canada, as a country, must, guarantee. It's about, lives. It's about people. But I think when it becomes, a for-profit. When it becomes a business, there is a problem. There is a problem.
Okay, I'm going to leave it there. I think I've taken enough of your time. Thank you so much for your time, Madame Jean.
Thank you.
It's a real pleasure.
Thank you very much.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.